Guys, welcome back to my channel. Today we are talking about the nursing interview. You must be wondering why or what happened that you were not selected or you are not called up for the final results for your nursing school. The reason is because of this nursing interview. Rather in Finland, after passing your kind of, we have the two phase. So when you do the written part and when you're done, if your results are accepted, then you proceed to the next phase, which is usually the interview phase. So you must be wondering what happened that or what are the things that you should take note when it comes to nursing interview in Finland and in most part of the world. So first of all, we all know that there has been a nursing shortage all over the world, especially in Western countries. So this is the time for you. If you are thinking of becoming a nurse, this is a great opportunity for you because most countries are doing what is called Operation 2030. So statistics shows that most of the nurses by then should be going on retirement, and there are lots of opening for many people to become nurses now, and this is the time that they are kind of doing those trainings. So now what you have to do or what you have to remember during your nursing interview, I think that the first questions are always like easy. What's your name? Introduce yourself and all those things, and you just have to, like, express yourself, be confident in what you're saying, so that the person who is interviewing you, or rather your interviewer, he kind of knows that, okay, this person, if he is talking with a patient, the patient will be kind of convinced with what the person is saying. So, and the most important thing is when they say, can you just talk about yourself? Can you say what's the reason why we want to become a nurse? And most people, for some reason, they are too honest, in my opinion, in saying that they want to become a nurse because because of salary. That will just make the interview feel that you don't really know what you're talking about, because you have to do your research before coming to this interview. So first of all, they know that it's not, if you're coming to study nursing, or you want to do a career, or you want to build a career as a nurse, and you are thinking about the salary, that's not a good reason. That is not a good reason, because there has been strikes all over the world. Nursing associations are striking day in, day out, because of their salaries, because of the workload. So they are kind of thinking that, okay, if you are in a place, and rather the salary, well, the salary is not the best. Let me say like that. Let me make it like clear. People who are not nurses, or people who are kind of the nurses themselves, they put it out there as if the salary is so good. We'll be making a video talking about the salaries of nurses here in Finland, and the different kind of nurses, because we have practical nurses, and we have registered nurses, and we have Terved and Hotel as well, who are called public nurses. So I'll be doing a separate video on that. But let's focus on the interview. The interview, when they say talk about yourself, they want to see some qualities of you portraying yourself to be a good nurse. So what does a good nurse mean? So they want to see your communication skills, your interpersonal skills. They want to see that empathy. They want to see some emotion in you that you can portray. You have to try as much as possible to portray some emotional part of you. Bring out that emotional part of you, because nursing is kind of an indie is let me say, nursing is a person contact job. Like, it's just like a customer service job, okay? And no matter your mood from home, no matter your mood from whatever, you have to adjust in respect to the situation. In most Western countries, especially here in Finland, the way you approach a patient is very important. And we do what is called in Finland patient-centered care. So we are doing everything, we are working as a team to provide the best care for our patient. So when during your interview, you have to now portray to the interviewer that you will be doing everything to ensure that your patient gets the best quality of care. And how would you portray this? This will not be by saying that you want to study nursing because of the salary. Yeah, so yes, I understand that you're gonna get bonuses, the salary is good, but it's not the main reason why you should think of starting or following a career, or starting a career as a nurse. So let me put it like that. So those are the things that you should always put in mind. Also, I always spoke about empathy. You have to go beyond salary. You have to go beyond salary, because I've noticed like people are always just about the money. It's not all about the money. You have to show that empathy. You have to show that you are out to help the world, because nursing is a calling. They say it's a calling. That's why some people argue that the salaries should not be increased, because if you are doing nursing, you should be passionate about helping people. So you have to show in your interview that you are passionate about helping people, not about the salary and all those things. And of course, I'm not denying the fact that you can also mention in your interview that you are pursuing a career in nursing because of job guarantee. That's a very good reason, I think, because if you say that you are pursuing a career in nursing because of job guarantee, it's a very good idea, because all over the world, mostly in Western countries, Finland, America, and all those kind of places, the job guarantee is there. Job guarantee means that you have the flexibility to move from one job to another. You have the flexibility to move from one hospital to another. You have the flexibility to move from one ward to another, depending on your need and depending on what you want to experience. So that's also a very, very good reason to bring out during your nursing interview. And especially here in Finland, they want that, because in Finland, most departments, they are kind of specialized in a specific thing. For example, if you go to a surgical ward, inside a surgical ward, there is still divided into many things, because they can be just an orthopedic surgical ward. So in that part, if you are working in that orthopedic surgical ward for 10 years, you are going to know only about those orthopedic things. But because you are kind of a person that is flexible, you want to learn more, and then you can be like, okay, after working in orthopedic surgical department for maybe 2 years, you want to move to ICU, you want to move to acute care, you want to move to internal medicine or something. So that gives more substance to your interview when you portray those things. And most often, I will always advise that before your interview, try to check the curriculum of that school. Check what are they offering, what are they doing. For example, mental health. What are the courses, the core courses? Because there are some core courses that you might be interested in personally, and also you should kind of think, because they always ask sometimes that, okay, where do you see yourself in the next 5 years? And then you are like thinking, those are things that, because you should have premeditated before the interview. So you can just say, once they say like, where do you see yourself in the next 5 years? For example, you can say in the next 5 years, you think that immediately after you graduate, maybe after 2 or 3 years of working experience, you can just continue to become a psychiatric nurse. You can continue to become something, or you want to portray a master's in nursing and become a nursing practitioner. Those are the kind of things that makes the interviewer to be sure that you know the things that you want. And of course, talking about the school, you have to talk about punctuality. You are a punctual person. You like to do your assignments on time and all those things, and you like group working, because in Finland they are doing what is called, you are mostly working in groups and all those things. So, and they are building your team working skills in that process. So you want to portray that you are ready to work as a team. You are ready to build your team working skills, so that it makes them to be very sure that, okay, you are the kind of person that they want to admit in their school. So these were the few things I thought I should bring out to you. And I'll be bringing more videos in regards to salaries in Finland, salaries for nurses in Finland, and the kind of different kinds of nurses that are available in Finland. So stay tuned and subscribe to my channel if you haven't, and I'll see you in the next video.